The third stream of this afternoon will be focused on great expectations, outcomes, and social impacts. Outcomes, optimal, improved, aspirational. They drive us as policymakers, as policy developers and policy hubs. And for implementers, they drive our kind of measurement of how well policy is succeeding, how well services are being delivered, and where we need to improve. So today we have a very esteemed panel of speakers who will be talking about outcomes and reporting. First we have Emma Tompkinson. Emma is a social impact analyst living and working in Sydney, Australia. She's particularly interested in the role of impact measurement evidence-based policy, including policy related to social investment. And she created the Social Impact Bond Knowledge Box for the Centre for Social Impact Bonds at the UK Cabinet's office. Emma will be discussing outcome reporting, the balance and burden, balancing the value for money assurances versus the obvious need for system without overburdening the system. So I'll invite Emma to the table. We'll have to be very strict on time, so we will be timing. And thanks, Emma.
Thanks, David. Yeah. I can do it if you like. Yep. And if you just go, hang on, we're on the wrong slide. So, I'm going to go all the way back. Yeah, right at the end. Yep. Okay. And on that little fella.
Got it.
Thank you very much. No? Already not sure what's happening here. Hi. So today I want to talk about reporting for outcomes rather than just purely reporting on outcomes. And just clarification before I start, I'm only focusing on the reporting that government requires from the not-for-profit sector in an interest of trying to whittle down what I'm going to say. So, just going to set the context here. Where we are is we're looking at a changing role of government. So in the past few decades, we've seen government move from being a provider to a purchaser. And actually, I thought last night perhaps even adding a movement towards almost market steward with the NDIS, but also as we think about different models, whether it's sort of commissioning and collaboration. We're also seeing changing expectations of government. So we've gone from a place where originally government would have a service that was open. And the fact that the service was there was sufficient. And we could measure that using inputs. Then the focus became efficiency. How much a government service is doing? What are the activities and outputs? How many people are going through? How many appointments are made, how many licenses are processed. But more recently, we're starting to see a focus on effectiveness, and that is outcomes or impact. So what we're really starting to ask our governments is how much are the services that you are both delivering and funding changing the lives of the people that they serve? So today what I want to do is run through 3 examples of ways that I feel, I'm not going to do that quite yet. I'm going to go to just point out that sometimes all you want is efficiency. Not all services should be about outcomes. So if you're thinking about processing your tax return, getting a licence, registering for benefits, some of these things you just want done right and fast. So sometimes we will choose to have an efficient service over somebody really focusing on our long-term outcomes. Now, what I've got here is a diagram of a performance management system. And this is some research that I was doing into outcomes-focused programs. So I'm going to describe it as an organisational at an organisational level, and then think about how we might extend that through to government at a systemic level. So what we have here is, as a service is delivered, the participants in the service, so service users, clients, beneficiaries, give consent for their data to be collected but also used and shared. So that data is entered into a shared case management system. So if you have more than one organisation working together, they're using the same case management system. In some of these programs, particularly those that are focused on outcomes, you want several organisations that are together providing a holistic service. So if they're all using a shared case management system, then I'm going to come back to point 3. What needs to happen is the analysis of the information in that system. And that's done by dedicated performance analysts. Now, we've heard a bit of talk today about data, but creating the meaning from that data is something that we're not very good at across the social sector. Partly because the people that are attracted to work with people often don't come with strong quantitative skills. But when I started studying these systems, I originally thought this will be about this amazing IT system. You put everything in, it spits out all the answers, everybody's well informed. Actually, what I found was that these performance analysts drove the system, but didn't drive it sort of just from their desk with their Excel spreadsheets, really drove it through the relationships that they formed with the frontline service workers, with the board, with their investors, with service managers, and that they were really building the capacity of their service delivery workers to engage with this system, to the point where these guys were saying that more than half of the work they were doing were driven by questions from the front line. People saying to them, I can see across 15 clients, but across the 3,000, can you tell me the relationship between this and this? Can you tell me what happens if we admit people in the morning as opposed to the afternoon? Can you tell me what's going on with Fridays? And then something these analysts are responsible for is feedback loops and reporting. But that's reporting that is a consequence of the system, not the purpose of the system. So those reports go to all the managers, to government, to the prison or other collaborators that they're working with, but also to service managers, and then to every frontline staff member. And the reports for those staff members are individualised. So they say across your clients what has happened in the past week or month. They'll contain a front page that anyone can look at between 2 and 5 seconds, but really useful information behind. So, for example, one of the pieces of information that one of these systems had was a list of everyone who, all the clients who hadn't been contacted in the last month. So the case manager could go, yep, oh, got to call Simon. But then perhaps what the most difficult part is adjusting services in response. So knowing all of this, when you have the information, can you actually make a decision to change it? So I guess my question is, we've got government who are sitting over systems like this. We have, to some extent, these shared case management systems. Employment Services has an extraordinary amount of data. Do we have the analytical dedication to add value to that data and feed it back to organisations, to people who work in those organisations, and even to the people who are accessing those services? So I'm going to run through 3 examples, and I'm already running out of time. But the first is a philanthropic fund, the Diana Princess of Wales Memorial Fund. What they found is they were spending a lot of time doing evaluations. These were not all high quality, and they weren't sharing the learning. So they completely readjusted their approach. And now it's all about what are we learning? What are we learning as an organisation? And what are the organisations we fund learning? And how are we then communicating that so that we are creating a greater impact across the sector? Second example is the Justice Data Lab. We're seeing a lot of government organisations say to not-for-profits, demonstrate your outcomes to us. Sometimes the not-for-profits have the best data, but sometimes government is in the best place to demonstrate those outcomes. So what the Justice Data Lab is, in the UK, any organisation can submit this information, so name, date of birth, gender, and one of these items about reoffending, and they will get, they'll match it with the police national computer and give them a sort of an effect size. Now, this is a voluntary thing, but you can imagine, what if this happened quarterly for organisations that government funded, and they just did it and fed it back to them? This is how you've gone this quarter, matched against and benchmarked against all the other clients in the system that you're not serving. What did they find? A lot of the time, the results were inconclusive, which meant they weren't statistically significant, so either not a high enough effect size for the number of people involved. But of those that were statistically significant, most of them decreased the reoffending rate. Some of them, the rate was inconclusive, but the frequency of reoffending decreased. But some of them, and I think this is really important to recognise, there were 7 programs that increased reoffending. And I think when we often talk about data, we talk about the ethics of people missing out on a service or testing something. I think we need to realise that we have a lot of services out there where everybody involved intends them to do very, very well. But they're actually producing poorer outcomes for people than if they'd received no services at all. So finally, what I'd like to touch on is that as government receives data, it's really, I think, an obligation to add value to that. So government should be identifying geographic strengths and weaknesses by organisations that apply for their funds, but also organisations that deliver them. This in particular is from the Education Endowment Foundation in the UK. And what they do, they have over 250 schools that have applied to sort of be part of their experiments. They run experiments on variables, so not whole programs, like we're doing the Mind Matters program or the multi-systemic therapy. What we're going to do is we're going to look at you schools over here, your kids that haven't done so well, they'll repeat a year, and these kids over here who have done so well, they'll go through. And then let's compare what happens. So that impact is in months. And their thing is that they say, look, teachers are in classrooms and every parent's an expert. They say, we do it ourselves. You walk in, you should try this. I read something in the newspaper. It sounds fantastic. They want teachers to be able to say, what's the evidence? If you can show me the evidence, I can make my own decision and I can incorporate these components into my classroom. Government could be doing this across all service areas. Other things they might want to identify are service gluts and gaps, biases in procurement processes, and then acting on them. Highlighting best practice, connecting organisations that could learn from each other or collaborate with each other, and rewarding organisations with good outcomes. For organisations that are reporting on outcomes, they're not getting a lot of reward for that. I'm going to go straight to the end and say I would love some examples of really great reporting practices, poor reporting practices. The chapter that I'm writing is not quite finished yet. If anyone would like to be part of reviewing it, please get in touch with me. These sites are social investment at the top, performance management and data use in the middle, and public data for service design at the bottom. But please do get in touch, and if you'd like to help me improve my chapter, I would love your participation. Thank you.
Now, building on our earlier presentation from our keynote speaker, Peter Shergold, this morning, we're going to go a bit New Zealand envy. We have Dr. Rodney Scott, who's a Principal Analyst and Research Fellow for the New Zealand State Sector Performance Hub, and currently leads the State Sector Reform Evaluation Program. Rodney was also awarded a PhD in System Dynamics and Public Management from the University of Queensland, and his presentation is going to focus on the New Zealand better public service reforms that have occurred over the last couple of decades. Thank you.
This is a tale about using targets and measures to drive collaborative performance within the New Zealand government. So that's not an excuse for you to fall asleep for the people who are just from an NGO perspective. I'm hoping that the examples from use to drive collaboration between departments is also going to be applicable for driving cross-sectoral collaboration as well. Bit of a history lesson, and this repeats quite closely from one of Emma's slides. It's the history of reporting in the New Zealand government over the last 40 years. The 80s were all about managing inputs, reporting on how you spent time and money. The 90s were about managing outputs, how you delivered services and goods, mostly volume measures, but with some service quality measures. The 2000s were about managing for outcomes, using intervention logics to understand how we contributed to societal outcomes. And that seemed to work pretty well for outcomes that were largely within the responsibility of a single agency, but was less effective for outcomes that spanned multiple agencies. So that's why starting in about 2011 and then coming into effect in 2012, we went with collective accountability for collaborating for outcomes. So the New Zealand government in 2012 announced the 10 better public service results. These are 10 outcomes that have been difficult to address or have proved intractable to previous attempts at changing them. There's three components. There's the result, which is what is the outcome, and these were chosen because they were important, because they're proven intractable, and because they require multiple agencies to work together to achieve them. The target, the degree of change that we expected to achieve over 5 years, and the measure, how that change was going to be assessed. So to give you an example, rheumatic fever is a serious childhood illness in New Zealand. It has particularly high incidence in New Zealand. So the result was to reduce the incidence of rheumatic fever. The target was to reduce it by 2/3 over 5 years. And the measure, we actually don't know how many people have rheumatic fever. All we know is how many hospital presentations there are, so that became a proxy measure. There are three requirements in selecting those targets and measures. One is it had to be challenging. So you set the target too high and people get despondent and they don't feel the need to participate. If you set it too low, then people think they can get there with incrementalism. And we really wanted to drive people to think big, try radical innovation, and to work at scale and work at speed. They had to be simple. We wanted this to be a conversation that we could have with the New Zealand public. We didn't just want to be getting feedback from professionals and lobby groups. So that had to be the kind of thing that you could understand within about 8 words and was basically intuitive. We expressed them as 10 line graphs over time, so it was a single measure and it either went up or down. It was fairly easy for people to get their head around. And that engendered a fairly strong felt accountability amongst public service managers. When the public was engaging in these topics, it drove some urgency within the public sector. And then finally, only having a few of them. We, in the past, had about 3 to 5 priorities per department. There's 29 core departments and 108 Crown entities. You very quickly get quite a lot of priorities. You need to, in order to make progress on these things, you need attention and focused attention. To do that, about 10 is about as many as we thought we could get. Here's the 10. So we want to reduce long-term welfare dependence. People who've been continuously on a job seeker benefit for over a year, we want to reduce that by 30% from 77,000 to 54,000. Want to increase participation in early childhood education from 95% to 98%. Increase infant immunisation rates from 85% to 95% and reduce incidence of rheumatic fever by 2/3. reduce the number of assaults on children. It had been going up at about 5% per year. We wanted to end that increase and then reduce it by 5% overall. Want to increase NCEA level 2s like a high school diploma or graduating high school in Australia. We want to increase that rate from 75% to 85% and increase the number of people with advanced trade qualifications up to 55%, reduce total crime by 15%, violent crime by 20%, youth crime by 25%, reduce reoffending by 25%, reduce business costs by 25% from about $4.5 billion to about $3.6 billion, and reduce, make it easier for people to interact with government. So for all 10 of these, we're only about 3 years into the program, and we're significantly above the baseline, and these were problems that we'd found intractable in the decade previous. For 8 of them, we had good trend data, and in each of those 8 cases, we're significantly ahead of the historical trend. So it's going pretty well. There's a range of reasons why we think it's going well, a lot of them to do with leadership and governance, but for the purpose of this talk, I just want to talk about the targets and measures themselves. And there's a few different components. One is the focus. So Robin mentioned before about cooperation and coordination, and we'd had a lot of sectoral arrangements that had worked like that, but without having a target or a unifying common goal, they really struggled to get any real traction. The commitment, we made the chief executives collectively responsible for achieving the outcome. So it's part of their performance appraisal is you can't have one of you achieve it and not the others. All 4 contributing agencies were collectively responsible for achieving it. And in a system that's very driven by that performance accountability, this seemed to have a big impact on the urgency that was felt by the chief executives. I've mentioned before the balance between complacency and despondency, and both of them are just excuses for not doing work. So you need to set that urgency just right so that it drove action. And then the regular reporting of the measures, which happened every 6 months, people could start to see that they were making progress and that things were going up, and this formed this virtuous cycle that fueled further working together. We hadn't done this before, and it was all a bit rough and ready. We took about 6 months to design them, and as Emma's presentation showed, you have to be really careful in how you choose measures and how you record them. So unsurprisingly, they weren't all perfect. I was pleasantly surprised with just how well they worked, given that they were pretty rough and ready. But just in the last minute or two, I'll go through a few of these to tell you about how we might have improved these results had we had another go at it. Result 4, which is about reducing violence against children. It relies on reported incidents of violence against children, and anyone who's worked in the family violence field would know that the more effort you put into reducing family violence, the greater your reported rate. So we think that we've probably had a significant impact on reducing the actual amount of violence. We've only reduced the reported rate by about 3%. So ideally you want to use direct measures instead of proxy measures when you can, and ones that don't rely on reporting. In family violence it's particularly difficult because it's really hard to get any reliable data on the real picture. Result 8, which is about reducing criminal reoffending. This wasn't a harm-weighted measure, it just said we're going to reduce the total number of people who reoffend. So that spans anything from very serious violent crimes, quite minor crimes, and it turns out that it's much easier and cheaper to reduce reoffending amongst those who've committed very minor crimes. So looking at the data, most of the improvement has come from people who were originally sentenced to community service rather than those who were sent to prison. Overall, we've achieved a 25% reduction, and some of that's come from prison, but if we had weighted the result by harm towards those more serious crimes, we might have ended up with a greater social impact than what we actually achieved. Result 6, which is about increasing the graduation rate for high school students. This is the only one that we disaggregated down to a local level, and we probably wouldn't do that again. So we disaggregated to each individual school and said, each school, this is your target. And some of the NCEA level 2, that's the assessment model, is internally assessed. So we created a theoretical incentive for grade inflation, where you're marking your own homework essentially. We have no direct evidence to see whether that occurred or not, but it is a potential impact. Have I got time for any more? Have I run out? Okay, sorry.
Another minute or so.
One more. All right, well, we'll go with result 9. Result 9 was the only one where we didn't set it as an outcome. Result 9 was to create a single one-stop online shop for businesses to interact with government. And that specifies a solution, not a problem. Where possible, we wanted to set an outcome and then provide the opportunity for the collaboration to work in a complex environment and develop an adaptive solution as they tried different things and saw what worked and what didn't work. And it turns out in result 9 that creating a single online one-stop shop is not the most effective way to reduce business costs. So in that case, the way we've adapted to that is we've focused on the target and the measure. The target's about reducing the total bill from businesses' compliance costs, and the measure is done through a survey sample. So in that case, the result probably set up the wrong behaviours. The result was assuming it was a complicated environment where you could just implement the solution, and in fact it was a complex social adaptive environment where we needed a more adaptive solution.
Our next presenter is Dr. Del Tweedy from the International Governance and Performance Research Centre at Macquarie University. Dr. Tweedy will be discussing not-for-profit accountability and addressing the disconnects between service providers, funders and regulators. So please welcome Del.
Thanks very much. So what I'd like to do in this presentation is briefly highlight 3 practical barriers, or what I've termed disconnects to not-for-profit organisations being accountable, and explore some potential responses. So this is based on 23 in-depth interviews we did last year with staff, directors and regulators in the not-for-profit sector, and our focus is on 2 aspects of accountability. First, we're looking at accountability for service quality rather than financial accountability or financial management. And secondly, what I've termed disconnects here are when people want to be accountable for their services, but for whatever reason, the reporting or governance practices don't support that. So we're not talking about fraud. We're talking about cases where there's an intent to be accountable, but that intent is being blocked in some way. So what we found in the study is a strong desire amongst the staff and directors we talked to be accountable, but then various kind of issues or barriers around being accountable in the way they wanted to. So I'm just going to run through 3 of those, and speaking to some quotes that came out of the study. So I think in terms of the first disconnect was between reporting, was when reporting to funders didn't necessarily either assess or oversee the quality of the services that organisations were delivering here. And there were 2 issues here. The first is when there wasn't enough detail in the reporting, or reporting wasn't measuring the right things to assess the quality of the services that were being delivered. Now, I've just highlighted one quote there. This is the only program I've ever worked to where the reporting is so minimal and accountability incredibly is almost non-existent. Now, I don't at all mean to suggest that this is a common situation. I know many organisations have incredibly complex reporting. I just put this up to highlight the variability of requirements across organisations. And also, I think the second thing that quote talks to is how poor quality reporting can be more of an imposition on organisations than more rigorous reporting that measures the types of things that not-for-profit organisations are actually interested in. So in this case, in this particular program, the organisation wasn't being able to demonstrate the quality of the services they were delivering because the reporting they were asked to do didn't enable them to make that case. I think the second issue is around the feedback or oversight of that reporting. So, one issue, a lot of organisations who were putting in detailed reporting weren't getting information back that they themselves could then use to report to assess the quality of their own services. The second issue was around the kind of oversight of those programs. A number of people we talked to were not just concerned about the quality of the services they were delivering, but also the quality of the services across the sector. And a number of the directors we talked to were saying, we want very high standards, our organisation is meeting those standards, and we want to be confident that we're being audited, assessed against those standards, as are other organisations in the sector. So that was the first issue. The second issue, or the second disconnect, was around when boards of organisations weren't receiving any feedback or oversight from the members of their organisation. Many of you will be aware the ACNC governance standards now emphasise the importance of boards having members who are able to ask questions of their performance and challenge the way the board's doing things. And also, obviously, in governance theory, you have the board looking over the CEO, and then there's the board themselves is accountable to a membership organisation. And in several cases, either the members weren't there, or they weren't active, or they weren't informed enough to be exercising that kind of oversight. So this organisation was delivering multi-million-dollar contracts. I think they had 30 members, and literally the director needed to go out and round up members to come to the meeting, and they certainly weren't asking kind of challenging questions that the director himself wanted to be asked. He was saying, I want people to, if I'm making a controversial decision, I want somebody who will ask me tough questions about that decision. And the broader question here, I think, isn't just about member-based organisations, but it's about who or what is asking boards those tough questions about the direction they're setting. And this kind of statement, I think the board thinks it's accountable to itself or to the chairperson. Have self-perpetuating boards. Again, people wanting to do the right thing, but also, what's the external reference point that they can also use to challenge themselves, that people can challenge them about the direction they're taking the organisation in. The third disconnect is more at the policy level, and this is around the potential disconnect between the very important goal of reducing red tape, but also maintaining a floor of quality service standards. Now, our study found, like many other reports have, a very significant concern about duplication, multiple accreditation, multiple reporting, and the need to reduce that, and I think that's very significant. Nonetheless, regulation obviously also has a very important function in setting a minimum floor of quality across a particular sector, and a number of the people we talked to were very concerned that that floor might be eroded by the kind of broader deregulation agenda if it wasn't done in the right way. And I guess as we shift towards more market-based delivery systems, one effect of that is to put significant cost pressures on organisations. So arguably that floor and how you set that, whether that's around qualifications or accreditation or whatever it is, setting that floor becomes more important the more you move to a sort of a choice-based system. So looking briefly at some potential ways of responding to those disconnects that I've just run through then. I think clearly because funders have significant power in relations to set reporting criteria, I think there is an onus on funders to look very carefully at what they're asking to be reported and whether that measures service quality in particular and whether that provides information back to organisations that they can use. I think though the broader issue there is that I think there's also scope to improve the relationships that the reporting is set in. So if you focus too narrowly on reporting, we miss that reporting is one aspect of accountability, and dialogue back and forth between the funder and the organisation is also part of that. And where we found the relationships were working best was when there was sort of mutual and ongoing communication as well as formal reporting. So in this particular case, for example, they had a quarterly meeting between the service provider and stakeholders that the funders also attended, and there was an open discussion of what was working and what wasn't. And those were the cases when people were more happy with the quality of the reporting they were asked to do. The second issue is a really tricky one. How do you bridge that gap when you don't have members? This was a response from a senior regulator I talked to. I don't mind if no one turns up at the annual general meeting. I don't mind if anyone asks any questions as long as they have the opportunity to do so. And sitting behind this idea was, he went on to explain, was the idea of a moral stakeholder. So the idea being that not-for-profit organisations are part of communities. Those communities, while they may not be members, will nonetheless kind of assert themselves in cases of malfeasance or where the board's taking an organisation in the wrong direction and so on. And obviously transparency is very crucial to that, and the ACNC's work is working very hard in that direction. Nonetheless, I think the issue with that is that doesn't necessarily provide the day-to-day or quarter-to-quarter feedback on the decisions that boards are making, particularly when they're making difficult decisions. They want kind of more frequent feedback on that. How do you provide that kind of ongoing feedback that an active membership should, and in some cases does, provide, rather than just in cases of crisis when the broader community rises up and raises issues. I think there's a couple of areas to look at there. I think one is looking at clearer external governance standards, so the board can say very clearly, well, these are the standards we're judging ourselves by, and be very transparent about that. The second is finding ways of bringing some of those broader moral communities into that regular discussion that I've been referring to. So if there are those people out there who are interested in the organisation, how do you talk to them on a quarterly basis rather than just work out, well, if we're doing something wrong, we'll hear about it at some point. And there's various ways that organisations might go about doing that I'll talk about in the chapter. The last point, just to finish on, around this potential disconnect between getting rid of red tape while maintaining minimum service standards. I think it's very important here to distinguish the approach needed between trying to get rid of duplicative red tape and unnecessary red tape. Duplication you can look at a national policy level. Are those two standards the same? A judgment of whether something's unnecessary, I think, is going to require a lot more detailed understanding from people who are kind of on the ground. So this very last point, the people who, if you're talking about children's learning, I can't make a judgment on that looking at a policy. You need to have people who know what a minimum standard of quality in that sector is. So if you're looking to decide that some red tape is unnecessary, you really need to involve those sector experts in consultation on those kind of decisions. And I'll finish there and look forward to any comments. Thank you.
So I'll now invite our discussant up for this stream. I invite Dr. Nina Terry, who is a partner and director at ThinkPlace, a leading design firm in applying strategic design methods to public problems. Nina is also adjunct associate professor at the Institute of Governance and Policy Analysis at the University of Canberra, and would like to see her thoughts on the presentations today.
Yep.
Thank you.
Great. Thank you. Look, it's a great honour to be here, and it was an excellent series of presentations, so thank you. I'm going to touch on a few key themes from each presenter and then do my best to make some connections, because there were some really nice connections, I think, coming across the three presentations. Just some key points out of Emma's presentation. Really liked the zoom around looking at that relationship between government's expectations on not-for-profits and this very contentious and difficult topic of outcomes and measurement. And if you've touched or looked at Mark Moore's recent book from 2013 around measuring public value, it's a really tough and complex area. And what all three presenters are doing is talking about this collective need to understand both at the design front end of these, what are outcomes, how are they defined and reflected, but then how do they go on in a system in terms of monitoring and managing them. Emma touched on this really important relationship, in fact all speakers did, around the multiplicity of roles. So from the not-for-profit roles, from the recipient of services to frontline workers to service managers, and critically in Emma's presentation about the role of the analyst, or the people that are actually the champions or the custodians or the gatherers of key information. She touched on a really important point about the connectivity or the difficulty of connectivity of information systems across disparate systems, and government has got a potential opportunity to better, I guess, be a springboard for a source of that collective knowledge about information, about services. Touched on a really important point about the feedback loops, but particularly about how does it actually change the system. There were some hints there in Emma's talk about empowerment, and I think it's a really critical aspect to see change happen. So it's not about someone doing something to someone else, but if we had more information, that may well stimulate both not-for-profits as well as government working together to solve things. I think that's a really important element. I have a couple of questions, but I might come back to those at the end, because some of them might sort of span across all three speakers. From Rodney's presentation, I think he took us to kind of almost like a zoom in and a zoom out at the same time around reporting. I do have one particular question which I will target to you, Rodney, at the end, because zooming in on the point of targets and measures, the New Zealand set the 10 outcomes set in 2012, very ambitious, but really a great example of actually having the courage to make some calls on, well, we think these might be statements of outcomes, then we might put a number to that. And I think that's just, there's a massive lot of learning there we should take from that. So I think we can all be bench setters and go see what's happened over there, is it working or not? And I think that's just a tremendous amount of work that you're already learning great things from. So I just think that was, there's a lot more to be taken out of the 10 minutes that you could give us today. But I really like the emphasis around selecting the right targets, but also having a very learning mindset, so the ability to look at it and saying, how might we do these things better? In terms of the last presentation by Dale, that was zooming in again around this, the not-for-profit accountability, and particularly looking at the aspects of service quality. There's so many dimensions that go into that. It's not just the transactions, but the standards that wrap around that. how much is too much red tape or not enough, what is the collective view around service provision, so it's not just one service provider but multiplicity of those. Really like the point that you touched on skills as well. So whilst Emma talked about skills from an analytical point of view of the system, you talked about skills at the board level. I was a bit intrigued by, I don't really care if anyone turns up at an AGM or not, but I just sort of thought, I think they should. I think that's a problem personally. So I think we could find a way, but you did touch on that, which is how might we actually engage more people, and that's part of the system. You touched on open consultation, the need to strengthen the relationships, and I think that was a bit of a theme coming across all presentations as well. But that also, everyone's actually trying to demonstrate value. We're all wildly in agreement of actually demonstrating value, and I think the more courage we have to actually try to put a stake in the ground about what we think that value might look like, I think we're getting close to actually having some good narratives and points of learning. So I'm going to throw a couple of questions. That was my summary. Is that too fast or not enough? And the reason why I actually didn't want to labour my own views too much, but let me interject and interplay between the group of presenters here and also to the audience, is that there are a lot of different points and perspectives that you have. But I just wanted to throw some questions, and you can either take it on board if you think it's directed at you, you can guess which if it's for you or not, or if you think it's yours, you can own it. So I have a question which is in the context of the role of government to non-for-profits. How can government help not-for-profits, I guess that's in a collective sense, be able to demonstrate their effectiveness? Like what can government do? You certainly touched on some ideas, Emma, but that's open to all speakers.
Just as a charity with their mission will sort of check everything they do against their mission, what I'd like to see is government funders and sort of service designers at the beginning saying, what are the outcomes that we're seeking here? And can we check everything that we do against those outcomes? Do our procurement processes further those outcomes for the organisations that will deliver them? Do all our reporting standards further those outcomes? And something that I want to touch on is flexibility. If you're truly focusing on outcomes, sometimes you need the flexibility to do something you didn't know you were going to do when the contract was written. Or the people writing the contract didn't know when they did it. So I think what we've started to see in employment now is people saying, we did have flexibility at the start, but then when we realised that there was some fraud going on and some underserving of communities, the government responded by introducing rules and fines, and a compliance culture was really sort of bred within providers, to the point where now we're seeing frontline staff who will say, we'll kind of try and make the decision for the client that is our guess of what we think the department wants, as opposed to what we think is right for the client. Mm-hmm. And I think from a government perspective, even though those sort of rules and fines were brought in to try and get outcomes for the clients, the kind of examining everything in the system against, what outcomes are we really here for, and will these sort of adjustments and sort of iterative changes further that, or will they actually start to work against it?
In New Zealand, we have this thing called the integrated data infrastructure, which is all of the different departments contribute their administrative data into a single database that's run by the Statistics New Zealand, which is a government department, but it operates at arm's length from government in an independent capacity. And what that has allowed is for each of the departments to be able to access really interesting information at an anonymised level, so it can't get individual details, but it can get trend and population information that allows them to correlate services delivered in one part of government with outcomes in another. So for example, in rheumatic fever, it allowed the health data of who was getting rheumatic fever to be correlated with the housing data on what housing environments were these children in. At the moment, that's only accessible to government, but one of the forward work programs is how do we make that available to people outside of government, being that it's anonymised, that it makes it less complicated from a privacy issue than it otherwise would be. So that might be something that you would like to explore here.
I think one way government can help is by talking to the people they're funding when they're setting up the reporting relationships and creating an opportunity to negotiate some of those some of the measures, again, working on the basis that there's a common interest to deliver quality services and to measure those. So starting from that basis and having a conversation with the people who are going to be delivering the services. I think the other aspect there also is perhaps what you could call mutual accountability. So if the conversation is partly about what is a service provider going to deliver, I think another aspect of that conversation is going to be what is the funder going to deliver back. So for example, I mean, a really common issue that came up, the number of people I talked to who were on tenterhooks about whether their funding was going to be renewed and under what conditions was just huge. So I think if you're asking people organisations to be much more rigorous about the way they assess service quality, I think there's an equal obligation on funders to sit down and say, well, these are what you need to do in order for funding to be renewed. These are the conditions under which we'll do it, and this is the timeline in which we'll advise you of our decision.
There's a common theme also coming from that, which is the need to collaborate, or the ability to collaborate. We talked about skill sets of being analytical and understand the data sets are there, but the ability to actually have a productive and constructive dialogue across multiplicity of people and many, many different goals and needs and drivers is an undercurrent to all of that. So whether it's the front end of the system, that better designing the original outcomes, whether it's the contracts which people actually get signed up to, or the evolution of those contracts where they need to change and evolve, that ability for actually everyone to come together quite productively is quite an important feature that's part of all those answers. Thank you.
Really interesting, those insights around perceptions of what's red tape and what's not red tape, about how it's about, how you define red tape from the EY report for the ACNC, and how some of the people you interviewed actually thought things weren't red tape, but something that that could actually provide a benefit either to the renewal of a funding agreement, or it's something you do because you have to report on outcomes, and if you're not meeting outcomes, well, why are you there? But I think it does expose a weakness in the approach of governments to reducing red tape, in that the focus on regulatory reform to streamline regulation and to reduce regulation is that there's a presumption that regulation is bad and that we need to cut it. And there's very little analysis of, well, what are the costs of regulation and what are the benefits of regulation, and then trying to optimise that regulation. And I think that, it was really interesting, sort of those observations, because I haven't actually come across them before. So yeah, more just an observation.
Thanks. There's an aspect that I found really helpful around outcomes, which describes it as an outcome theology, which we're all slightly in the grip of, which ignores the difficulty that we have with outcomes around things like attribution. And that there has been a practice around commissioning of a kind of black box commissioning, where we kind of say to organisations, here's some government money, we don't really care how you get the outcomes as long as you get the outcomes. And actually there's a great loss of learning that can go with that, and sometimes the process itself gets shielded under commercial confidentiality, and then we never know enough about the process. So I think focusing on the attribution issues is important. We need to know if violent crime has gone down because violent crime is falling in all advanced democracies, or whether it's because of something that the government is doing. So I think this kind of, perhaps we need to be, if we're evolving from a focusing what comes next after the collaborating for outcomes, maybe it's going back a bit to process and undertaking what I've heard described as perspex box commissioning, where we say what's actually going on in this process which is getting the outcomes, and if we can work out how that's happening, then how do we think about spreading that out further? So is there a danger that we kind of fetishize outcomes and we don't focus enough on how we're getting there?
I think we've certainly seen that, so a lot of my experience has been with social impact bonds, where we're paying for outcomes. We put a lot of effort into sort of defining and sort of setting up, like how much do we want to see this outcome improved, and what's it worth. What we haven't done is really looked at what is the capability of an organisation to deliver towards outcomes. And that's something that we haven't done in government or in the not-for-profit sector very well. But I think that I like this idea of this perspex box, because it is, people say when they put analysts on programs and they have this information cycle, the words they use are, the fog lifted. Suddenly we could see what was going on. I think that an outcomes focus means that the process of delivering the service should be less prescriptive, but no less sort of apparent or discussed, or in fact, it's probably even more important to have more information about your sort of continuous evaluation and improvement process. But that should be very much about pursuing the outcome rather than where we're continuously producing information to make it okay that we weren't really sure how we were getting there to start with. And I'll just mention something that we saw recently was a social impact bond in Rikers Island failed to achieve its outcomes. Rikers Island is the juvenile detention facility in New York. Now, what happened there was they weren't allowed to change their service model. So even though they were being paid to reduce reoffending, they weren't allowed to adjust anything they were doing. And afterwards, the service delivery organisation said, if you want to reduce reoffending with young people, you also have to deliver services in the community and support them after they get out. And we're only delivering services in the prison. And it's and people in the UK were going, well, if you're being outcomes focused and you knew that, how would you possibly not just quickly add services in the community to achieve those outcomes? But they were still constrained within a very prescriptive service model. And they say what we were testing was the service model rather than whether we could achieve the outcome. So I think the approach of releasing the prescription on the model, but certainly encouraging the cycle of information about what's happening and that continuous learning is really important.
Well, look, very quickly, I wanted to add another vote for causation. I think that I agree outcomes are uncritical or are accepted, but I don't think we understand enough about causation, particularly in a multi-causal environment, which is what we're talking about with complex issues. And I think we've got to very much understand that a lot more deeply. One other just very quick point is whose outcomes, because I think the way that government or policymakers describe outcomes will be very different from the way that citizens will. And I think particularly when you're looking at the most disadvantaged members of the community, you've got to be very clear about their involvement in establishing outcomes and understanding how you can work with them to show benefit there.
Thanks. And a very quick question for Roger. I love the concept of collective accountability where chief executives have to achieve their performance together, and that's their performance agreements say so. I'm wondering whether that also extends to something that's been very difficult to get underway anywhere in Australia, which is collective budgeting. So do those chief executives actually have their own budget lines, or do they share a mutual budget?
So there's different approaches in each of the 10 results. The justice sector is probably the most mature of them, and that is they have a proportion of their funding, all of their funding is appropriated to each department. Then the chief executives have decided that a portion of that funding will be pooled into a common justice sector fund. So they've got their core delivery of prisons and courts and police, but then a pooled funding model for determining additional services. On the first question, I think that it's a very good question, and I think it needs to be an and approach, that there is a risk of fetishizing the latest thing. So we need to understand inputs, we need to understand activity and processes and how they contribute. We need to understand outputs, and we need to understand outcomes.
I'm just going to pick up on the causation one. I think causation is really tough, and even when you think you've proved it, sometimes you haven't. I think that's why that Education Endowment Foundation is going with these trials of little things and just saying if we've got a number of schools where they're doing this and we're seeing this change, then it'll be due to that. And they do it in a kind of a randomised control trial environment. But one interesting example that always sort of goes against everything that I kind of know is the walking school bus as an obesity tackling measure where somebody picks up all the children on the way to school and they all walk to school together. If you do that in isolation, there's no effect. But in very successful, in successful programs that are more holistic, that have lots of components, it's often there as a component, and they'll say it's a very important component. So I think even when you think you know that something does or doesn't have an effect, sometimes when you start combining it with other things, that will change.